Good afternoon, everyone. Thank you for joining us for today's webinar, Voices for Wellness, Empowering Advocacy and Mental Health Clinicians. Before we begin, I'd like to make sure everyone can hear me okay, so please just type the word yes into the chat box if you can hear me. Great. Each attendee is in listen-only mode to avoid having background noises that may distract you from listening to the webinar. Throughout the presentation, a staff member will be managing the chat and question box on your Zoom control panel. If you have any questions or responses during the presentation, please type them into the chat box. Registration is open for our 2024 AMHCA Annual Conference. Our conference will be held June 9th through the 12th in Charlotte, North Carolina. More information can be found at www.amhca.org/conference. And without further ado, I'll now turn it over to Dr. Cheryl Cummings.
Good afternoon, everybody. Thank you so much for all of you coming out today and joining us. I am Dr. Cheryl Cummings, your chairperson for the Public Policy and Legislative Committee. I'm delighted to be here today with you to guide and serve as your host for this conference. We have lots of people that are joining us, and we are definitely excited. Today's event is called The Voices of Wellness, Empowering Advocacy and Mental Health for Clinicians. We know that this is a topic that you're very excited about and that you're wanting to learn more about. Our objectives are as follows today. We're going to talk about advocacy and action and talk about some of the things that AMHCA has been doing. We're also going to give a brief overview about the Counseling Compact as well. And then we're going to end our session on today talking about the role of advocacy and how you as a mental health clinician or a student can get involved. But before I pass the floor over to our speakers, I'd like to introduce members of our Public Policy and Legislative Committee. We have here Denise Tajik. She is she's out today. We have Danya McKinney, Jennifer Gutierrez, Dr. Susan Merrill, Napoleon Harrington, who is our AMHCA board representative, and then myself, Dr. Cheryl Cummings, who is your chairperson. The purpose of the Public Policy and Legislative Committee within a mental health organization is to make sure that we advocate for policies and legislation that support the mental health needs of individuals, communities, and our profession. And that is our purpose here as the Public Policy and Legislative Committee of AMHCA. This committee is working really hard to make sure that we're influencing government policies, regulations, and legislation, not only at the local level, but the regional and national levels as well. Our goals may include public policy advocacy, which is identifying those key mental health issues and advocating for policies that promote access to mental health services, support the mental health research, and destigmatize mental illness, and improvement of mental health care delivery systems. Our goal and purpose is legislative engagement, right? We are going to monitor different legislative developments related to mental health, lobbying lawmakers to support relevant bills and amendments, and providing expertise to testimony legislative bodies. We are committed to public awareness. We want to make sure that we're educating the public about mental health issues, promoting understanding and empathy, and mobilizing our grassroots supports for the mental health initiatives. We're huge on collaboration. We're going to make sure that we're collaborating with other organizations, advocacy groups, healthcare providers, and stakeholders to advance the common goals and initiatives in mental health policy and legislative. Finally, we're going to make sure we do some research and analysis. We want to conduct some research and analysis on mental health policies and issues and gather data to make sure that we support advocacy efforts and produce reports and publications to inform policymakers, the public, and of course you as the membership. Overall, the Public and Policy and Legislative Committee plays a crucial role in shaping the legal and regulatory environment to better support mental health and improve outcomes for individuals affected by mental illness and the clinicians who work in the field. Without further ado, I would now like to turn the floor over to our interim executive director of AMHCA, Dr. Beverly Smith.
Hello, everyone. I hope that you all are doing well. Thank you for coming and being a part of our webinar for today. So thank you so much. And thank you, Dr. Cheryl, for your leadership. And thank you to Miss Rebecca Whitson. I was going to say Dr. Whitson for being on and helping us as Director of Events. And thanks to the committee. But equally and most important, thank you to our participants and attendees who are here with us today. I wanted to come and just briefly talk with you as it relates to the presentation that the committee is bringing, Clinical Mental Health Care and Advocacy, the intersection of Medicare. And so as we talk about advocacy, As we talk about advocacy and the intersection of advocacy, we look at Medicare, clinical mental health care and advocacy, the intersectionality of Medicare. And so most of you all may know, as we rolled into 2024 in the next slide, it talks about how we ended up in expanded access for Medicare. So we are glad that finally is here. Since 1989, since the inception of Medicare, we have not been providers. Licensed clinical mental health counselors, licensed professional counselors have not been providers, but we are now providers and can apply. I'm gonna get you to advance my slide, please, for the next one. Nope, go back. And so just to highlight for you again, we are now Part B Medicare providers. And being such, we're now able to address and provide services to Medicare beneficiaries. And this passing of act signed in by Biden addresses issues of Medicare parity within the behavioral health care profession. We now, as licensed mental health counselors, licensed professional counselors, can help to alleviate the workforce burden that's in our profession. We can also help address the mental health crisis that exists among our children, our teenagers, as well as our adults. So this is monumental. It's a celebratory event to recognize and to acknowledge that this has transpired and that we are now able to provide services to Medicare beneficiaries. It does mean first you have to apply, but again, Medicare expanded access, at last, it is here. On my next slide, we continue to talk about clinical mental health care and advocacy, the intersectionality of Medicare. Again, we are authorized now providers to provide services for Medicare beneficiaries. And so President Biden signed into law via the Consolidated Appropriation Act, H.R. 2617, on December 23rd, 2022, right? So that's when the Consolidated Act was enacted. We became, as a result of Congress passing this, and he actually signed into law on December the 29th. And again, January 1, we are now authorized providers. So it allows us to get paid for the services that we provide as licensed mental health counselors. And this is extremely important that we also specify, it means license. Your state will provide you with the license or credentials necessary for you to apply to be an approved, authorized provider for Medicare. Additionally, when we talk about Medicare services and being providers, there are a few things that being a part of Medicare Part B coverage allows us. And these are a few things of the benefits that provide to us. We're now able to receive payment for those receiving mental health care services as, again, Medicare beneficiaries. For those who are 65 and older, but also, and sometimes we forget this piece and we should not because it's equally important, we also now can provide services for those with disabilities who are qualified for Medicare and Medicaid, and that's important. So 65 and older, right? As well as those who have a disability, qualifying disability. We're able to get reimbursed up to 80%, the lesser of the actual charge for the services. We're able to diagnose and treat Medicare beneficiaries with disabilities, a serious mental disorder, and a substance disorder, okay? We're also able to engage in behavioral health integration with primary care providers. So that means we're able to be in certain settings and serve on the interdisciplinary team to provide mental health care services. And this did not happen in the past. In the past, professional counselors licensed, equipped, trained, and experienced could not be on a team in a hospital and provide services and build for Medicare benefits. Okay. On the next slide, I also list a few more things that we are able to do now because we are licensed mental health care authorized Medicare providers. We're now eligible as licensed mental health counselors to provide services in qualified health facilities, including in rural clinics. And this is one of the benefits, right? That now we're authorized providers of Medicare. We're able to address the shortage of professionals and being able to serve individuals in certain areas in our country, particularly in rural areas. Okay. In addition, we're given the ability to require members of hospice and interdisciplinary teams to also allow us to come aboard on that team. We're also able to participate in telemental health services, to provide individual psychotherapy. And again, we can work with beneficiaries of Medicare, but those who are dually enrolled as Medicaid as well as Medicare. As we continue to talk about the intersectionality of Medicare and how it relates to clinical mental health care and advocacy. Again, as I stated, it was in 1989 when everything was first inception of Medicare. On up to now, we have not had those benefits to provide services. We have not had authorization. But now that we do, you look at from 1989 to now, the long years of advocacy for this to happen. And so AMHCA, American Mental Health Counselor Association, worked in conjunction with a host of other organizations in our profession. And we work under the umbrella of the Mental Health Workforce Coalition, and we've worked for years. So thank you to the coalition for all of its work. And just note that we continue to provide training and services and information in reference to clinical mental health counseling as relates to advocacy. And so you'll see on my latter slides, I'll provide you with some resources. But because of the authorization, again, we are Medicare providers for Part B, right? And we're able to do the following: provide individual and group psychotherapy, family counseling, test and psychological evaluation, diagnostic tests, medication management. We're also able to provide certain prescription drugs that are usually self-administered. We're also able to provide some services as it relates to partial hospitalization. And then we also provide a one-time welcome to Medicare, a preventive visit, and that's available. On the next slide, I also share with you, again, a code, but I also share that, hey, we have been here advocating for licensed mental health counselors, providing the service, providing the advocacy so that we can now be providers for Medicare. It is not a mandate that you be a provider, right? But you can. But here we provide a QR code for you to let us know how has that process gone for you? How can we better advocate for you and for parity when it comes to Medicare? For those who want to opt out, we've shared information with our members, and I provide for you a resource. If you want to opt out, you can definitely opt out, understanding that in the information that CMS provides, you can opt out. It's normally for a 2-year period. There's not necessarily a form, but there's a template that the MAC uses, which are the Medicare Administrator Contractor, and they can guide you through that process. They shared with us that opt-out is generally a 2-year time period. They ask that you give them a 90-day leeway for that. But for those who just want to opt out and go a little further and just terminate their services, and you could do that as well and not participate in the Medicare through the regular panel, as well as going directly with them. Now, some have asked in the past, well, do I use my MPI number to apply for Medicare? Do I need a new MPI number? You will use your same NPI number to apply. And we provide a list of Q&A for you in the resources that would answer those questions. But some of the other popular questions that may include, do I submit an application to every single state in which I'm applying? Then yes, you have to do that. And so on the resource list, we provided information for you. The first resource is a general Q&A that a lot of MFTs and MHCs ask. And so that has been provided for you from CMS, on down to web-based training, as well as becoming a provider. And so again, this is a list of resources We have provided in our Advocate magazine that just went out this week, an award-winning magazine that provides all the information updates as it relates to clinical mental health counseling, then that is available. But in that magazine, we provide for you a host of links to webinars and training that have taken place in the past to share with you more about the services that we provide. But before I go, I want to share with you and just remind those that we not only advocate for clinical mental health counselors on a federal level for legislation, we also advocate for and promote continuing education so that we are trained and we're on the cutting edge of technology so that we're providing the best services possible. So join us in continuing that education. In the Queen City in Charlotte, North Carolina on June the 9th, we have our pre-conference, and we have our annual conference again, Queen City, the same time frame, in North Carolina from June the 10th through June the 12th. And we provided for you a code if you want to join AMHCA, as well as if you want to come for our annual conference. We have an awesome time at our annual conference. We are a great organization, and when you come to annual conference, you will see it as an organization, a place where you belong, where you fit in, and you're not just a number. We not only will advocate for you, and we advocate for over 130,000 individuals, professionals in the nation, but we will advocate for you, embrace you, provide mentorship, and welcome you into the fold of AMHCA, and we'll ask you to help us to continue to advocate for our profession. So thank you so much, Dr. Cheryl and the committee, and you have an awesome remainder of your webinar.
Thank you so much, Dr. Smith, for that update. We are extremely excited and proud about being included in Medicare. Thank you to you and the task force that worked so diligently to make sure that that passed for us. Next, we'll have Dr. Avery, Dr. Dominique Avery. She will come and talk about the Counseling Compact.
Oh, wonderful. Thank you. We should have just a couple slides to show some update. The Counseling Compact is a wonderful example of advocacy in which we're putting ourselves out of business. In the short time since the Counseling Compact has been introduced, AMHCA has, and our state chapters, has been a huge driver of the grassroots efforts to get the Counseling Compact passed in now 33 states. This is a phenomenal achievement. It has progressed so much faster than anybody anticipated, in part to the wonderful work of our members and our state chapters in collaboration with other stakeholders in the states to really get this moving. We currently have 9 states that have bills in active session. So if you are a member and you're in any of these states and you would like to get involved or know what's happening and get connected, please get in contact with the American Mental Health Counseling Association Counseling Compact Task Force, and we'd love to support you and get you involved in some of the actions of working with the legislatures and getting some movement in these bills. So we have Washington, D.C., we have Arizona, we have South Carolina, we have California, we have Hawaii, we have Illinois, Minnesota, and New York, as well as Rhode Island, all have bills in active sessions right now. So this is wonderful, and we'd love to get in contact with all of you. If you're in a state that already has the legislation passed, or if you're monitoring the passing the legislation in your state, and you'd like to know what the Counseling Compact Commission is up to, they're still in the rulemaking process. So you can go to the Counseling Compact website, which is counselingcompact.org. All of the meetings are open for public comment, are typically available for attending as a viewer, as long as they're not a closed session. So you can get some updates on rulemaking and the progress of the compact, see proposed rules of how they're actually going to implement the details of privilege to practice and all the data tracking systems. We do not yet have a launch date specific for the Counseling Compact. We're still waiting to hear from them as they are moving through the progress, and hopefully we will have some more information for everyone when we get closer to the annual conference. So you can see some information about what AMHCA has been up to, as long as the history of AMHCA's advocacy for the compact on our website, as well as some recorded webinars about how the counseling compact functions and what to anticipate, some toolkits for getting legislation passed. And we really look forward to seeing everyone at the conference to be able to get some additional information. And we have on the next slide, we have our map of the compact. So this is the first time that we have had this much blue on the map. So this is really exciting. The dark blue is places in which all the legislation has been enacted. The light blue is places where we have legislation that's been filed. Some of the states that are light blue, the current legislative session has closed. So we're just waiting for the session to come back around. A few of the gray states are places in which we have had legislation in the past, such as Texas, and it's gotten really close, but we don't currently have an open session for legislation right now, which is why we don't have anything pending right there. But we are working on building some momentum, doing some connections in the interim, and bringing some legislation back around for when some of these states go back in session in 2025. And I believe Dr. Smith had a few things to add on the compact as well as our officio member for the counseling compact.
I was just getting ready to add that, but I also want to thank Dr. Avery and her team for all the work that they do in monitoring the counseling compact. Not only do they monitor the counseling compact, I just want to emphasize that her team, the task force, is available for states who need help or support, meaning this group, they actually have boots on the ground. So if you call and say, hey, I want an appointment, help me walk through the process. They will walk through the process with you, show you from their experience what has worked, and so that we can help you move it forward in your state. I am an ex officio member, executive committee, as well as a commission, and I am there to represent AMHCA and to share your voice. There are 4 organizations that are there as an ex-official organization, which includes the American Counseling Association, National Board for Certified Counselors, American Association for State Counseling Board, and again, AMHCA. And we are there to provide guidance. We don't have a vote, but we're there to provide guidance. I want to announce too, at our leadership conference, at our leadership symposium at annual conference, we will have the newly hired executive director, Greg Sears, who will be there talking with our leaders, answering any questions. So please register for leadership at annual conference and hear firsthand if you want to help move your state forward. And Dominique and her team will be available at annual conference to provide that one-on-one consultation if you need it. So thank you, Dr. Avery, so much.
Thank you. And I'll just end by saying the states in which we've passed legislation are some of the ones with the most active AMHCA chapters who've been actively involved in that participation. So it's interesting to see the correlation between those who first got on the compact and getting it passed and where we have the most active AMHCA representation across the US. So really big shout out to all our members and their grassroots work.
So I will pick it up from there. And one of the questions that's been posted in the chat is a perfect segue into some of the information that I'd like to share with you all today. And that question that was posed was, how can we get involved if we reside in a state, in this case in New York, in the question, that might have pending legislation? And one of the key pieces, one of the key messages that I can share with you is to get involved with that legislative process. You would be surprised at how few people actually testify for different legislation. And one of the pieces that I was asked to address is kind of how things happened in Nebraska. One of the pieces that's a little bit unique about Nebraska, in case you don't follow legislative structure in all of the 50 states, is that we are actually a unicameral state, whereby both our House and Senate are combined into one chamber, thus creating the unicameral. And one of the pieces that I've always been just astounded about when it comes to the advocacy and legislative process is how infrequently people participate in that process. So within your state legislative organizations, there is information about how to submit testimony. You can provide written testimony to support the legislation that's been introduced. You can work with your state senators and representatives to introduce legislation. As Dr. Avery had identified, we are nearing the end, or in many states have ended, the current legislative session. And so if the bills have not been already introduced, they will need to be introduced in the next legislative session. And that's one of the ways that you can become involved. And that's one of the benefits of having those active AMHCA chapters. There's comfort in having your fellow AMHCA members participate in that conversation and getting the legislation introduced, and then supporting the testimony or so providing testimony in both the hearings and again in that written form. There are specific requirements about how you would need to identify yourself as a testifier and how to submit written testimony, and that information is contained within your state's legislative authority information. So if you've not testified before, it's not scary. They are people just like you and I, and in many cases are really looking for opportunities to greater serve the constituents that they represent. And I think that's one of the reasons that the Counseling Compact and Medicare has gained so much momentum. Is it really is an opportunity, as you and I know, as counselors, to really enhance the services that are available to constituents that the legislators represent. So we have coming up next some more information from our graduate students about what advocacy looks like and how you might get involved.
Good afternoon, everyone. I'm Donya McKinney. I'm an LPC, an LMHC, and an NCC, and also a member of the Public Policy Committee. And I'll be presenting today with Jennifer, who represents the grad students who are a part of AMHCA. We're excited to explore personal engagement and mental health advocacy with you today. Before we jump in, I was hoping to ask you, Jennifer, to share with everyone, before you joined this webinar today, when you heard the phrase mental health advocacy, what did you think it meant, or what did you think of?
Well, for me, hello, everyone. Thank you for having us. Well, for me, I didn't think of advocacy as much, actually. I actually didn't think of the word because when I got into graduate school, I didn't know the importance of it until I started taking classes and the word came up frequently and more frequently. And then I started realizing the importance of us trying to advocate for ourselves and being able to make it important for us to be able to look out for those people who need someone to talk to them, to listen to them, and to guide them through their mental health concerns. But yes,
a valuable perspective. Yeah, no, I think that's a valuable perspective, is that a lot of us, when we enter the field, aren't really thinking about advocacy as much, right? We're excited to just have our degree and begin working, so we're not necessarily thinking of advocacy. So thank you for sharing that. Each day as counselors across the nation, we are offering critical mental health services to individuals, families, communities, and schools. We know that we're on the front line of witnessing the firsthand impact of mental health policies as discussed today with Medicare as well as the Counseling Compact. So we witness both the positive and the negative on the lives of our clients and on our colleagues and ourselves. So it makes it really imperative that we understand our role in advocacy. For today, we'll be using a working definition of advocacy in the realm of mental health as encompassing a range of actions aimed at promoting the rights, well-being, and equitable treatment of individuals affected by mental health concerns. As mental health clinicians, advocacy is not just the external observance of organizations' efforts, but an integral part of our professional and ethical responsibility to clients, communities, and our field at large. Advocacy involves actively speaking up for the needs and the rights of our clients, whether it's in the clinical setting or in the public forums like today or through policymaking channels. It's about being a voice and amplifying the voice for those who may not have the capacity or the opportunity to do so. So how will we do that? How do we put it into action? Let's see. In our daily practice, advocacy already takes on various forms, but I chose to focus on 3 for today because the first one I think many of us are already familiar with if we're in the field. When we think about client-centered advocacy, we advocate for our clients by ensuring that they are receiving the best possible care and support that is tailored to their individual needs. This may involve advocating for access to specific treatments within the community. This could look like substance abuse clinics, improving access to substance abuse clinics within the community, or providing group counseling support groups to local communities that may not already have that access there. We also may have been asked, if you're already in the field, to advocate for your clients by writing letters of support through accommodations in school or work settings, as well as advocating for community access to support services like school-based mental health treatment. So there are ways that we show up every day in the field with client-centered advocacy. When we take that one step further and consider systemic advocacy, we work to address systemic issues, and we can work to address systemic issues within the mental health care systems that we operate in. So if we're in a community agency, we can work within those spaces, or if we just are a part of schools or church, we can work within the systems we're already existing in to reduce stigma. The value of reducing stigma is to increase awareness for the general population, to allow empathy and understanding for our clients. And the more that people are engaged with destigmatization and reducing otherness, the more they are able to use their vote to support policy that promotes mental health and mental wellness. And then as we think about increasing public policy awareness, we want to make sure that if we are aware of something that's going on, like the Counseling Compact or Medicare, that we are sharing that information with others who may not readily have access to that information or aren't keeping up with those things. And finally, as far as systemic influence that we can have in advocacy, prioritizing equity. So that just looks like advocating for increased resources and funding related to mental health in your local community or at the state level. Looking at the third topic I wanted to cover for advocacy in action is self-advocacy. So supporting our professional identity is essential in advocacy as a whole, as we try to move into spaces where we would like to raise our voice or have our voice be heard. It's important that people understand why we are integral and critical in mental health counseling treatment, period, across the nation, so that when we do end up in, community legislation committee meetings, that our voices are valued and respected as members and vested parties and caregivers for community members. Enabling resources and skills and support for clinicians. So the better we are collectively, the better we are serving the people, the more invested the people are in advocating for mental health care, period, and also our profession. So it is important that we are attending trainings like this, putting on trainings like this in our smaller communities, within our professional organizations at the state level, and then also making meaningful contributions. So participate. We're just asking that you take time to find a way to connect with an organization that is adding value to mental health concerns and getting involved. So those are ways that daily we can jump into advocacy and action. Jennifer's going to continue the conversation a little bit more, talking about our 3 C's of advocacy. Oh, I'm sorry, it's still a little bit more. Local, state, and federal. My apologies. At the local, state, and federal level, I think we've already heard a little bit about that. So local, you can stay engaged by attending city council meetings, going to school board meetings, being aware of local governing bodies where mental health policies are being enacted, and connecting with your local community. That is any coalitions or anywhere where mental health concerns are discussed. At the state level, I think that Dr. Susan Meyerly shared about her experience personally. In your own personal state, legislative sessions are being held at different times throughout the year. It's important that we have an awareness of when those things are happening so that we can keep abreast of what is coming up within our state regarding mental health and make our voices heard, whether that's completing a template form, letters being sent to our state representatives, or drafting a letter ourselves. But we do have resources and ways to get our voices heard. and then attending committee hearings where mental health bills are introduced and debated. At the federal level, we just encourage you to stay informed, heading over to websites like congress.gov and govtrack.us. They provide searchable databases. I actually went there myself, and under congress.gov, I just typed in mental health into the search bar, and it pulled up all of the bills that are currently being debated on or considered in Congress at this point. And that's a really quick way to figure out how you may want to get involved and what things may be impacting your area. As far as other organizations that also provide information, AMHCA is one, like we're doing today. ACA is another. The National Council for Behavioral Health as well offers updates and analyzes the information on federal policies that would impact our career field and impact the public. And so now I'll turn it over to Jennifer to talk about the fees.
Thank you so much, Ms. McKinney. I am pretty much going to be slightly repeating some of the things that she mentioned. So here are the 3 C's of advocacy. We have collaborate, connect, and communicate. First and foremost, you want to try to join some committees or professional organizations. Now, that will be one way that you can collaborate, and some of them were mentioned before, right? So you can, for example, look at me, I'm here. I am part of the AMHCA organization. I am also part of the Public Policy and Legislation Committee. So this is what I did. I ended up going online, researching and finding out how I wanted to collaborate, or, join an organization so that I can be part of the world of advocacy and mental health organizations. You can do it at state and local levels, and there's so many ways. I highly recommend going online. Online you can find so many different ways that you can collaborate and find out where your niche is. For graduate students, this relates to you as well, right? You can become part of an organization like this one. You can also, there's also ACA. There is, for example, I am in the state of Georgia, and I decided I wanted to join about 3 or 4 organizations. And another organization that I joined was LPCA of Georgia, so that I can be in the local chapter as well and get involved locally and see what is different between one organization and another, and how many ways I can collaborate with people, with professionals, with other graduate students as myself. And that way you can get involved in many projects or presentations or anything that's going on in the community or in the profession. Connecting, so you can connect by engaging with some colleagues. For those of you who are already in the field, you can also connect rather than complain. Sometimes we get caught up in complaining about different issues that are out there, and I'm not sure if you've heard it in the workplace. Oh, I'm just tired of this being this way or that way. Guess what? If you decide, let me go ahead and take action, let me go ahead and try to do something different, then you can try to have a different result, right? And then increasing awareness through educating others. The more you learn and the more you put it out there, the more people are going to be aware of it. Sometimes people don't know about something, and they may live in a certain life of ignorance when it comes to a certain topic. So the more you educate others, the better prepared they are, the better they can take information and treat it differently than they're used to treating some information, whether it's how to treat others in that are going through some sort of a mental health issue. Okay. Graduates, this includes you and me, because I'm still a graduate student. Networking with other graduates is essential. You can go ahead and find a forum in your grad school. If you're doing it online, you can find a forum. If you're doing it face-to-face, you can ask your advisor at school and ask your professors to find out how you can network and find events, meetings, and so on, that you can connect with others, okay? and get involved in this field. Then we have the annual conferences. There are some annual conferences that are coming up, and you can go ahead and join those. You can go ahead and sign up for it. Sometimes, I mean, I think if you are a graduate student, you might have some sort of a discount. I'm not sure. But I suggest going to annual conferences was one of the biggest things that was emphasized to me. Do not necessarily wait until you graduate for you to go to an annual conference, because you get so much information in those that it helps you throughout your process, your educational journey. Then we have communicate. Tailor communication to your audience, okay? What does that mean? To know your audience, know who you are talking to, whether you're speaking to a group of, let's say you're talking to legislators, or you're talking to educators or other counselors, whoever you're speaking to, make sure you're tailoring that your communication to those people, opposed to speaking the same language to everyone. Okay, and just as Ms. McKinney mentioned, to destigmatize mental health. How can you do that? Talk about it differently. Don't let the myths live about how mental health is described, right? Have an open talk with people. You can focus on the positive opposed to the negative, right? So those are different ways that you can destigmatize mental health. There's so many other ways, and I'm sure you know some of them. Graduate students, we can discuss with professional mentors. I mentioned that in the connect part, but you can, this is more on communication, right? Talk about advocacy opportunities. How can you get involved? Ask someone in your school, ask someone, even if it's another graduate student. Sometimes some graduate students may have more information than other graduate students, and you, from communication, you get to connect and then get to collaborate. They all come together, right? You can look at poster boards or create poster boards. If you find like a bulletin board that has information about some ways that you can communicate, that you are communicated with, or you can communicate with others to spread the word on advocacy, please go ahead and take the lead and help others, or join others to taking the lead in advocating for the field itself, okay? All right, thank you very much for having me, and I look forward to being part of this committee.
Yep, to wrap up, we just urge each of you to embrace your role as advocates, not just for your clients, but advocates for mental health awareness and for public policy, and as ambassadors for our profession. We challenge you all to just choose one thing that we spoke about today and commit to doing that as soon as today or beginning tomorrow. Thank you so much for joining us, and I pass the floor back to Dr. Cummings.
All right, I'd like to thank everyone for joining us on today. Before we go, we definitely want to make sure that we do our question and answer session. I'm going to ask Ms. Rebecca, are there any questions for our committee members?
So far, I think most people were wondering if the slides would be available, but I know they've been dropped in the chat. So definitely scroll back through the chat box to find where you can download the presentation. We'll make sure to post that one more time before we jump out. But we'll give it a second to see if anybody has any other questions. There is one note. I'm starting a CMHC program in Buffalo, and we're including a capstone that is an advocacy project the students will complete over 3 semesters. So that's very exciting news. Looks like we do have someone that says, I have a question regarding disability. I have the same question about the recording. Where will it be available? We will have that on our website. So as soon as this is over and we're able to get the recording from Zoom, we'll be uploading it to our YouTube channel, and that will also go on our website.
So the question about disability, what is the question?
We don't have the question yet.
Okay.
So
right.
let's see. Oh, it did just come through. Wondering if you have put in some consideration for access with people who are deaf, blind, or have another disability.
Are you referring to this webinar or when we have our annual conference? Can you please type in or share, give us a little bit more clarity? And so that you know, for our annual conference, we will make sure that we give all attention to those who have special needs, whether deaf and blind, and other disabilities. In our past conferences, we've had interpreters, we've had translators to help and assist with that. As each individual registered for our conference or webinars or so forth, they are always given the opportunity to inform us of any special needs that are there or that you will need for us to make accommodations for. And that applies for our webinars as well as that applies to our annual conference. Ms. Rebecca Woodson is actually director of events, and she's the person who would normally receive that information once you submit it. So I hope that provides a little clarity or answers the question.
Absolutely. I was going to say the exact same thing. We do ask that while you're in the registration process. We also ask, if you have food allergies, things like that as well. So we try to make that a very comprehensive, registration description of yourself so that we can make sure we're accommodating everything that we can. Let's see. Oh, here we go. Here's the clarity. You were talking about the future of our care toward people. I'm just wondering if there is a plan that includes disability or plans to include a disabilities platform.
I see the question. I'm just not quite sure if you're talking about an electronic platform or what platform we're actually speaking of. But to answer your question, AMHCA has always been cognizant of providing accommodations. We will continue to do that. And if there's anything that we need to make special accommodations for that an individual has, then just always let us know, and we would definitely do that. A couple of years ago, we launched MSJ, our Multiculturalism and Social Justice Committee. And so that committee will be formalized and become one of our standing committees. Under that umbrella, we will focus on various things, which also includes disability. It also will include those with suicidal ideation and training, a special networking for that. And in fact, this year, we partner up with another organization and provided a certificate program for those professionals who wanted to have that certificate in suicide prevention and awareness. So to answer your question, yes, I'm going to drop my email back in the chat because I do want to hear a little bit more about your question and making sure that your question has been answered and addressed. So I'm dropping my email back in the chat. If you can, send us a quick email. Thank you so much.
Thanks, Dr. Smith. Looks like we do have another question. Could you share again where to find the how-tos if you're going to support with testimony or work with legislators on legislation?
Did you repeat that question for me, Rebecca? I am looking for that question very quickly.
It's right above, it came in right above the clarity for the disability. It says, could you share again where to find the how-tos if you're going to support with testimony or work with legislators on legislation?
I can actually answer that question for you, Cheryl, if you don't mind. So on your state legislative website, for submitting testimony for both your House Senate and your House representative, there are guidelines about how to submit that testimony. And so I would encourage you to log on to your state's website and access that information so that you can submit your testimony in appropriate format, so it does become included in the transcript for that legislative session.
I also would like to add, please join in with your local chapter or your state organization, because they are currently providing legislative efforts and advocacy, and we are better and more powerful in numbers. And they also may tap in on you or tap you in to provide a testimony if they know that you're interested. So I definitely would work with the local organizations that are already in the trenches. And as she mentioned as well, Dr. Susan, the avenues for contacting legislator and the government directly.
Thank you so much. We have another question. I'm a graduate student in Florida and graduating in May 2025. I plan to return to California. Can I begin being an advocate now for California, or do I have to wait until I move back?
You can begin advocacy now. I would suggest, because you are currently a graduate student in Florida, connecting with the state there, whether there's a chapter or a divisional organization that provides advocacy. With the Mental Health Coalition, we work with individuals out of Florida, actually, from the American Marriage and Family Therapists. We work with that organization very closely. We're in the process, as far as AMHCA, of relaunching and getting a chapter started there. But we definitely affiliate and support advocacy in California. We can connect you with some appropriate individuals that can help you begin your grassroots and advocacy efforts.
Thank you so much. Looks like we do still have a little bit of time. That was all the questions we have so far, but we can leave it open for just a couple more minutes to make sure if anybody has any other questions, we have those answered.
So Rebecca, this is Susan again, and one of the pieces that I just suggested, and I typed this in the chat, is there's a number of resources and direct links and emails that have been listed in the chat. So if you would like to save the chat, you can certainly do so. At the bottom where you would respond in the chat, to the right, you'll see 3 dots or an ellipsis. And if you click on that, it says save chat, and you'll be able to save all of the different resources that have been compiled in the webinar chat. So you don't have to click and try to screenshot and have everything open. That's an easy way to save those resources for future reference.
Thank you so much. I know there's been a lot in the chat, so I'm going to scroll through there too, just to make sure we didn't miss any questions in the chat box.
And while you're scrolling through, Rebecca, I just wanted to say to everybody, thank you so much for attending today. This has been phenomenal. I'm encouraging each and every one of you to get involved in our advocacy efforts. I had no idea, as a mental health clinician of 20 years, how there were decisions right here in my very state of South Carolina that was being made about the mental health profession without my voice being heard. So I recently, within the last year or so, understood the importance of having our voice heard, because there's decisions every day that is being made regarding our mental health licenses, our mental health profession. So please, please, please get involved. Get involved. Let your voice be heard. If there are no other questions, again, we thank you for attending. We will have another public policy and legislative update at our annual conference, at the AMHCA annual conference, I should say, in June. And then in September, you will be hearing from us again. We'll have another webinar forum just to give an update about all the wonderful things that is happening in the world of public policy and legislation for mental health. So until then, please be safe, be well, and I look forward to seeing you again soon.
Rebecca, can you hold on and not cut it off? I'm gonna give the participants and presenters, you could click on a camera for a second after everyone leaves.
I just sent you a message in the chat. I'm not able to keep it up without the webinar still running, because it's with it being a webinar instance versus.
Thank you. I just saw it.
All right. Well, if there are no other questions, I just wanted to also say thank you to all of our presenters today, and thank you to everyone for attending today's webinar. Once you leave, you'll receive a survey for the presentation. We would appreciate if you would complete that and provide your feedback. If you have any questions about the presentation, please feel free to email us. I know a lot of the presenters have put their email addresses directly in the chat. You can also send an email to info@amhca.org that we can get to the correct speaker as well. And I hope everybody has a great weekend. Thanks so much for joining us.